Her fate is out of her hands. For more than a decade, Judith has had a transplanted kidney. But due to the severe shortage of medicines, for 4 months she's been unable to get the drugs to keep the kidney going.
Ese es el miedo que me da, pues, que no tengamos medicina. Y entonces vaya lo pasado, uno vaya, se muera.
Her doctor says he has about 700 more patients in hospital, also facing the imminent loss of a transplanted kidney.
Él fue mi hermano que me donó.
No, entonces es una impotencia de ver de que, bueno, yo me quito una parte de mi cuerpo para hacer a mi hermana, para salvarla a ella. Y se supone que tú como gobierno debes prever, bueno, mira, aquí hay una medicina que no puede dejar de estar en Venezuela.
For Venezuelans, the hunt for medicines is desperate. Most drugs are out of stock, and even when you find them, there's another problem. This person was looking for several types of medicines here, but she could only find this one. These are 2 boxes she needs per month, but it costed her 12 million bolivars, which means about a third of what she makes in a whole year. I've met other people around this pharmacy and they're saying there's no chance they could afford something like this. Critics say this is an example of the failure of the so-called socialist revolution, but the Venezuelan president says US-led sanctions prevent him from importing medicines. Things are worse away from big cities. This is Apure, in the south near the Amazon forest and one of the poorest states in the country. Here I gained very rare access to a public hospital, a place where the government does not allow the media in. Josmer is 7 months old and malnourished. The scabs on his head and body were caused by an illness related to malnutrition. His mother cannot afford his medicines once she leaves hospital. Children like these are having to get, for instance, antibiotics for a price which could be 10 times the monthly minimum wage. And the people who live in poor communities like these are absolutely unable to buy these medicines. Little Oriana has an uncertain future. She needs surgery to treat her lung failure, but her family can't afford the antibiotics to get her ready for it. A simple drug out of hands of many Venezuelans.
Y cuando ve a su nieta así, ¿cómo se siente?
Mal. La tengo yo de chiquitica.
For Oriana, as for so many Venezuelans, lack of medicine is an almost certain death. Vladimir Hernandez, BBC News, Caracas.